the delay in collecting urines and getting urine results is delaying the time that the patient is in the department. So as you can tell, we're sort of focused this year on turnaround time for discharged patients. And I'm going to tell you that one of the things that's delaying getting your patients out of your department and keeping either your internal waiting room or your beds full is waiting for those urine samples. So after I heard that, I was getting tired of hearing of it, so I thought, well, let's do a little research project and figure out really what is the reason that it's taking so long for us to get urines. So I wrote a little research project prospectus for our partners in CEP to get their approval for me to do this. And I told them that the problem statement was that one of the most consistent complaints among CEP America providers is the delay in discharging patients due to the failure to collect and order urine specimen. So the question is, what are the barriers to the processing those samples? So we decided to do a study. One of the things that's really great about being a part of CEP is look at all the data we can collect just from among one another. So I actually sent through the nurse portal an email out to all the nursing directors at CEP sites and asked for people to volunteer to have their staff complete a survey on SurveyMonkey. So the questionnaire was really designed to collect information regarding the demographics of the staff, practices and attitudes of the nursing staff about collecting urines. And I have to honestly tell you right now that the questionnaire, I looked at it in retrospect and decided it was really biased because I had some very preconceived notions about what was getting in the way. And one of those things, one of my preconceived notions, because I'm a seasoned nurse, is that I think that I've always thought that there was a difference between older nurses and younger nurses in how we practice. And I'm going to tell you that unfortunately that didn't get borne out in this survey. So let me just tell you that 32 sites agreed to participate, to have the staff participate in the survey. 23 sites actually had surveys submitted by their staff, one or more of their staff. The total number of responses I got was 257 responses, which I thought was really great. These are the sites that participated. One or more people in these departments actually completed the surveys. Now I will say that I did have to throw out a few surveys because unfortunately, even though all the people who participated did graduate nursing school, some of them don't know how to complete surveys. So when you ask somebody what's the name of the hospital you work at and you get their first name, that didn't work. So let me tell you a little bit about the results. One of the questions that I put in the survey was, providers order samples more frequently than they're needed. And I wanted people to tell me whether they agreed with that or disagreed with that, thought that was sometimes or not. And as you can see, 42% of the people said sometimes and 24% of the people said yes, that they did, or always. So 2/3 of the people responding to this survey believe that our physicians order urine samples more often than is necessary. I'm going to say to you that I think that we should consider validating that assumption on the part of our nursing staff to see if you really think that's true, if you really think that there's a practice issue among the physicians, because that's something we can do. Or do we need to educate our nursing staff about all the reasons why some of these urine samples are important? I think that we have to look at both sides of the coin and decide specifically for your site what the issue is. And by the way, for those of you that participated, your individual site information that I collected is going to be sent to you, just so you know. Then I asked them, the supplies I need to collect urine samples are available when and where I need them. And I asked people to tell me whether that was true or not for them. And as you can see, 91% of the staff said that yes, they had their supplies available to them. It was actually a very small percentage that said no, less than 2% said no. What's interesting to that is in the open-ended questions that I will give you more detail about in just a little bit, that conflicts with what they said when we asked them what they needed to be able to do the job better. So I'm a little confused. Then we said urine sample collection takes too much time when I have a lot of other things to do, and as you can see, again, more than 2/3 of the staff said yes, that it does get in the way. Now what's interesting about that is that there was another question, in a lot of the questions I asked them about asking other staff members to help them collect the urine samples, and they were overwhelmingly negative about doing that and basically said that they don't do that they don't ask other people for help. So one of the things that we should all look at in looking at what's happening in our individual facilities is, do we need to encourage our staff to work more as a team with the other folks in the department, and when they're busy, ask other people to help them get the urine samples? I wanted to look at what the difference was between when we have to collect urine samples for infants, children, and adults. And so I asked questions specifically for those different age groups. So 82% of the staff that responded to the questions said that they would not ask another staff member to help collect a urine sample on infants. I was really shocked when I saw that. That surprised me a lot, especially because I didn't like to collect kids' urine samples. 60% of the staff did say that they would do a straight cath. 98% said they would never do a suprapubic, never ask the doc for a suprapubic stick. And when it came to urine bags, as you can see, it was pretty evenly split as to whether they would use a urine bag to get a urine sample from an infant. I'm not saying that any of these are right or wrong ways to collect urine samples, but this is what the staff is saying they will or will not do. For children, 87%, again, of the staff will not ask another staff member to help them collect the urine sample. 14% said they would perform a straight cath. 62% said they'd give the cup to the parent and ask the parent to get the urine sample. And as far as urine bags go, it was pretty well split, half and half, yes and no, whether they would use a urine bag. Now what about adults? Again, 75% of the staff said that they would not ask another staff member to help them get the urine sample from an adult. 90% of them said they would just hand the urine cup to the patient and request a specimen. 26% said that they would accompany the patient to the restroom to assist them with collecting the sample. And 2%, and I know of one hospital in particular, that actually has a lab, a phlebotomist in the department who is also responsible for collecting urine samples. Wow. Yeah. And when that works, it works great. It doesn't always work, but when it works great to have somebody other than the nursing staff responsible for making that happen. So the other thing I was curious about was, a lot of times people say, well, I couldn't get the sample because the patient couldn't go, the bathroom was busy, whatever, and so I asked them, how long, as a nurse, how long would you wait before you ask the patient the second time for a urine sample? As you can see, the largest bar is 30 minutes. So 37% of the people who responded said that they would wait 30 minutes. We had almost 9% say when they got around to it. I don't need to say anything else. Probably the most telling of all the data had to do with the open-ended questions at the end of the survey. The first question was, the one thing that would help make it easier to collect urine samples is, and I've broken out some of these pies to show you the things that, that stood out. The first was that they were either unsure or nothing. And I thought that was interesting, that they didn't even have ideas about what would make it better. Almost 17% said more patient education and cooperation from the patient, so they were kind of shifting the responsibility back to the patient. 15% said more staff or teamwork, and again, I thought that was interesting since they won't ask each other to help them. 10% said more bathrooms, so when you get around to that, if you could implement more bathrooms, that would be a really good thing. And what didn't come up as high in the list as I thought would be more requesting the samples and triage when the patient comes. 9% said that, and I'm surprised it wasn't 95% that said that. So the responses from the nurses were actually very interesting to me. The last open-ended question was, my ED has addressed the issue of timely urine sample collection by, and the largest response, or to almost 25%, was nothing or they were unsure. Wow. Wow is right. I was very surprised at that. So whatever it is that you're doing, whatever you are doing with respect to this, the staff, 25% of the staff don't know it. 16% said more staff reminders and communication would be helpful. 14% said that they need some new processes and tracking and maybe a policy. 13% said, collect it and triage, and another 13% said, shockingly, staff and teamwork. So here's what blew me out of the water, basically. I really did think, when I looked at all the demographics, that I asked a lot of questions about demographics. I asked how long they've been a nurse, how long they've been an ED nurse, how long they've worked at your hospital, what their highest level of education was, what their basic level of nursing education was, what shift they worked. And I'm going to tell you that none of those things made a difference. Not one of those things. And I was sad about that. I really was. Except then I thought about it and I thought, well, you know, all of those things we can't do anything about. All of those demographics, there's nothing about those demographics that any of us can do anything about to make this issue go away. So, demographics did not significantly alter the practice or any of the attitudes about urine samples. The staff would not regularly look to their coworkers, and so I think that we've got some things we can do there. Generally, the staff believe that urine samples are ordered more frequently than is needed, and so I think that opens up a conversation with our providers and maybe perhaps some additional education. Collecting urine samples upon arrival will help to decrease your TATU. I'm coining that. We have TATD, TADA. Now we have TATU, which is turnaround time for urine. And the message then, fortunately, that I have to give you is that in order to improve the turnaround time for discharge with respect to urine is managerial attention, because I'm going to tell you that staff do what they know is being watched. If they know you're paying attention, I'm sorry? What's inspected is respected. I like that one. Okay? If they know that this is something that is important to you and something that you're going to be monitoring, they're going to do it. And the more that we can impress upon them the importance of collecting the urine samples early in the patient's arrival in the department, the sooner you'll be able to turn around the patients. And I'm going to tell you that it's a lot of your lower acuity patients that are the ones that you need to be collecting these from. And so the impact on your turnaround time for discharge, I think, will be significant if you address this issue.